This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, so I was going to present a case of a 3-year-old that presented to the ER. This is sort of a hypothetical patient, but not dissimilar to other patients that we've all seen. A 3-year-old who came in, fever and a rash, really uncomfortable, difficulty swallowing. So as far as sort of the things that use as an entree into a differential for a fever and a rash, what are some of the infections that, or allergic reactions or chronic infections? Is that strep? Yeah, so strep can give you a sore throat, and characteristically the rash of it would be sort of a scarletiform rash, so scarlet fever. Generally with the sore throat, a couple days later you get sort of a sandpaper rash on the extremities. What else? Measles, right? So the sort of classic childhood exanthems, so measles, rubella, we saw an outbreak in unvaccinated populations last year. Rubella, periodically creeps its head up. Chicken pox. What else? Anaphylaxis. Fifth disease. So what does that look like? Do you know? Yeah. So human herpes virus 6. Oh no, that's adenovirus. And slap cheeks. What else? Anaphylaxis, so yeah, allergic reactions, sometimes kids atopic dermatitis, not usually with fever. But then, this is a different condition where a patient presents with a condition that, unless the diagnosis is made, it can actually lead to life-threatening complications. Yeah, so Kawasaki's, great. So Kawasaki's is generally a clinical diagnosis. There are adjunctive lab tests that are performed to confirm the diagnosis in equivocal cases. We'll talk about the clinical criteria in a sec, but why is it so relevant? COVID. So you can get a COVID-like syndrome with Kawasaki's. In terms of the complications, the main thing that you can get is a coronary artery aneurysm, which in kids is the most common acquired heart disease. So Kawasaki's association with coronary artery aneurysms, and those can be life-threatening, and there's treatment that's utilized to avoid it that we'll talk about in a second. So in terms of the clinical diagnosis, the entree into it is 5 days of fever. Kids who are less than 6 months present a little bit more atypically. So any kid with 7 days of persistent fever that's unexplained, you have to consider Kawasaki's, and you generally do a laboratory evaluation in that age group. Above 6 months of age, 5 days of fever, and then this is trying to show you what a strawberry tongue is. Yeah, so there's intraoral, so the way you can just sort of think about it, I sort of think about it from sort of head to toe. So you get bilateral conjunctival injection, you get intraoral manifestations or perioral manifestations. So that's a strawberry tongue or dry fissured lips. Cervical adenopathy greater than 1.5 centimeters. And then the peripheral manifestations are pedal or foot edema, hand edema, and then sort of a non-specific rash, which is generally described as sort of maculopapular. Notably, it's not vesicles or bullae. So if you have 4 of those 5, sort of from head to toe, with fever greater than 5 days, that's the diagnosis clinically. And that patient gets admitted for 7 days of IVIG, and usually it's 4 to 8 weeks of high-dose aspirin as a preventative for the aneurysms. So hopefully that gives you a little bit of a perspective on sort of a disease that, I would say, once every couple years you see a case of that, but if you don't know the clinical syndrome, then it potentially can lead to really significant complications. Anyone have any questions on that?
You ever treated with steroids?
It's not treated with steroids. It's intuitive that you would. It's a vasculitis. It's unknown trigger, inflammation. Yeah. So the IVIG is the immunosuppressant that's more effective. Yep. Cool. All right.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.